So hello friends, welcome to Pathlink and I am Dr. Siddhi Dave and we will discuss a very good topic and that is salivary glands from our standard textbook, that is Robbins Pathology, and we will discuss all about salivary gland in this video from the Robbins, and this video is mainly for the UG MBBS student and it can be seen by the PG student also for the basics of the salivary gland. So without further delay, let's start. So in the salivary gland, there are mainly two type of gland, that is one is major and the second one is minor. So in the major salivary gland there are three types of salivary gland and there are parotid, submandibular and sublingual. So and minor salivary glands are also there and they are distributed throughout the mucosa of the oral cavity. So salivary gland, see the anatomical position of the salivary gland. This one is parotid gland, here submandibular gland is situated and here is sublingual glands. So you can see that the facial nerve is dividing our parotid gland and submandibular and sublingual gland. So the next we will discuss the high-yield MCQ topics from the salivary gland and you have to just memorize this. That is this is all about the salivary gland only, the most common neoplasm of the salivary gland, and that is pleomorphic adenoma, the most common gland affected by the pleomorphic adenoma, and that is our parotid gland. Most common malignant tumor of the salivary gland, that is our MEC, Mucoepidermoid carcinoma. Most common benign tumor of the salivary gland in children, that one is hemangioma. Then most common malignant tumor of the minor salivary gland. Mostly 50% of the minor salivary gland tumors are malignant and the most common one is adenoid cystic carcinoma, and the tumor with the peritoneal invasion, that is also the adenoid cystic carcinoma, and tumors of the hotspot in the scan, and that is Warthins tumor. So this is our high-yield one-liners from this topic. And next one is Xerostomia. We will discuss from the benign condition and we will go further towards the tumor part. So xerostomia means dry mouth. You can see the dry mouth here. So xerostomia, dry mouth due to decreased saliva, seen in the Sjogren's syndrome. Sjogren's syndrome, it is also, and for the NEET PG also, and Sjogren's syndrome is one of the high topic of the pathology also. That Sjogren's syndrome is autoimmune disorder. Then in that dry mouth, dry eyes, keratoconjunctivitis, sicca, then dental caries also there. So you have to remember this, anti-rho and anti-la. It is positive. Anti-SSA, rho, and anti-SSB, anti-la. It is positive in Sjogren's syndrome. So this is our high-yield topic. What do you have to know? Then T cell infiltration will be there in the Sjogren's test. You can see here that this is our screamer test. You measure the tear production because in Sjogren's syndrome tear production will be less. So, and the Sjogren's syndrome patient is likely to develop non-Hodgkin lymphoma. And xerostomia is also seen in the complication of the radiation therapy of head and neck and drugs. So we will quickly revise the Hodgkin lymphoma and the non-Hodgkin lymphoma. So Hodgkin lymphoma will be more localized in the one group, and non-Hodgkin lymphoma will be seen in the mostly multiple peripheral nodes. In Hodgkin lymphoma, it will be contagious spread, and non-Hodgkin non-contagious spread. Then in the non-Hodgkin lymphoma, Walde's ring and extranodal presentation is common. While in our Hodgkin lymphoma, there is a pathognomic cell, also known as RS cell, owl's eye appearance. Ristenberg cells is seen, and B symptoms are also there. Fever, night sweat, and weight loss. These are our B symptoms seen in the Hodgkin lymphoma. It is also there in the NHL also, but it is the specific for the B symptoms. Then it is Hodgkin lymphoma. Then the treatment part, ABVD. Adriamycin, bleomycin, vincristine, and dicarbazine will be for the HL, Hodgkin lymphoma, and for non-Hodgkin lymphoma, R-CHOP, rituximab, cyclophosphamide, hydroxydonorubicin, then oncomine and prednisolone. So it will be for the NHL. So the next topic is Sialadenitis or Sialedenitis. Whenever in the MBBS, if you heard the itis means Inflammation. So Sialedenitis, it is for the salivary gland inflammation. So it is due to the inflammation, trauma, viral, bacterial infection, and or autoimmune disease. Most common viral cause of the Sialedenitis is mumps. Most prevalent form of the disease is mucosal. Then what is ranula? Ranula is basically the ranula is cyst. Cyst is lined by the epithelium due to sublingual gland duct obstruction. Then what is plunging ranula? Plunging ranula is nothing but the cyst between the two bellies of the myelohydroid muscle. So that is plunging ranula. Then sialolithiasis. Whenever the word comes, lithiasis means stone formation. Nephrolithiasis, renal stone. Sialolithiasis means stone formation in the salivary gland, salivary duct. So this you are seeing the mucosal bluish tinge. Then in the microscope you will see the cyst is lined by the granulation tissue, and here you are seeing the mucin. So this is our mucosal. Then so here we have discussed our the benign condition of the salivary gland, and we will further we will discuss the benign and malignant both facts about the salivary gland tumors. So tumors mainly you have to just once you have to just listen the words name of the tumor, and we will discuss the only IMP tumor for the UG student also. So benign and malignant. In the benign, pleomorphic adenoma, also known as mixed tumor, then Warthins, then oncocytoma, then canalicular adenoma, then basal cell adenoma, then other adenomas, ductal papillomas, and in malignant, mucoepidermoid carcinoma, then acinic cell carcinoma, then adenoid cystic carcinoma, adenocarcinoma, carcinoma X pleomorphic adenoma. It is a malignant counterpart seen in the pleomorphic adenoma, then squamous cell carcinoma and other carcinomas. So first we will discuss the high-yield tumor of the salivary gland. You must know if any tumor, if you must know about the salivary gland, that is pleomorphic adenoma. Pleomorphic morphology is pleomorphic adenoma. So it is also known as mixed tumor. So first we are seeing this swelling over the parotid region here, and the after surgical removal of this tumor, we are seeing the rounded and well demarcated demarcated masses there, and cut surface is showing the grayish white with myxoid appearance and bluish translucent part. It will be seen in the microscopy as the chondroid area, cartilage-like area. So most common salivary gland neoplasm, that is pleomorphic adenoma, benign tumor, mixed tumor. Why it is mixed tumor? Because it contains the epithelial part, ductal and myoepithelial, plus it also contains the mesenchymal part, chondromyxoid stroma. Then radiation exposure increases the risk for the pleomorphic adenoma, and overexpression of the PLAG1 gene is seen in PA. So this is our microscopy. You are showing the well demarcated lesion, and we are zooming the picture, and you are seeing the chondromyxoid stroma here, and here you are seeing the ductal and myoepithelial cells forming the ducts. So the next one is Warthins tumor. Warthins tumor, papillary cyst adenoma lymphomatosum. So it is very peculiar. You are seeing the very peculiar image. You are seeing the double line of the cell. You can see, can you appreciate the double line of the cell here? There is double lining of the cell, and here you are appreciating the germinal layer, lymphoid follicle. So double lining by the oncocytic cell, and in between the lymphoid follicles aggregates. So it is our Warthins. So Warthins is the second most common of the salivary gland neoplasm. Unique is that it almost arises exclusively in the parotid gland, and the lining is composed of the double layer of the oncocytic cell. The inner lining is columnar, outer lining is cuboidal. Then what are the oncocytes? This is the basics. What are the oncocytes? Oncocyte is swollen cell, large cell containing the numerous mitochondria, and it will appear as granular and eosinophilic in our slide. So having the large nuclei and prominent nuclei, the oncocyte is nothing but the swollen cell having the numerous mitochondria. So the next one is Mucoepidermoid carcinoma. So most common primary malignant tumor of the salivary gland. Here the Bell's translocation, chromosomal translocation 1119, and it will create the fusion protein CRTC1 and MAML2. Circumscribed, it is the circumscribed, but well-defined capsules are not present in mucodermal carcinoma because it is malignant. Tumors having the infiltrative margins. Then cut section showing the pale gray-white content, small and mucin-containing cyst. In microscopy, you will see the core cyst and cystic configuration of a squamous, mucus and intermediate cell. You will see this kind of cell in your microscopy. So small to large mucus-filled vacuoles, and this is the only tumor in the salivary gland having the subclassification, having the grades. If you are a PG student and if you are having the case in your exam, you must have to subclassify, you have to grade the mucoepidermoid carcinoma. So this is a 4x picture of this tumor. You are seeing the mucus-filled cells here. This is our intermediate cells, and this is very beautiful squamoid differentiation, squamous cells here. The next one is our adenoid cystic carcinoma. It tend to invade a perineural passage. Adenoid cystic perineural invasion. ऐसा याद रखना. Then MYB, NFIB gene rearrangement will be there. Smallly, poorly capsulated, then infiltrative and gray pink lesions. Small cell with dark compact nucleus can cytoplasm. कुछ भी नहीं याद रहे तो क्या याद रखना है? Cribriforming growth pattern resemble as the Swiss cheese. Swiss cheese. टॉम एंड जेरी में आता है ना येलो कलर का जो चीज होता है वो ऐसे ऐसे गोल 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 Swiss cheese appearance. It is seen in the adenoid cystic carcinoma. So here you can see the Swiss cheese appearance, cribriforming pattern of the adenoid cystic carcinoma. Tubular pattern will be also there. Here you are seeing, can you appreciate the tubules? And this is our solid part of the tumor. So adenoid cystic carcinoma, perineural invasion and cribriforming will be there. Then next one is acinic cell carcinoma. Cell resemble the acinic, serous acinar cells of the salivary gland, small and rounded nuclei, variable morphology. So cytoplasm, what you have to remember in acinic cell carcinoma is the cytoplasm typically contain the zymogen granules, purple granules, recapitulating the normal serous acinar digestive enzyme. So you can see this is our normal salivary gland. This is our, you can see here the acinar cell. So the zymogen granules. Cytoplasm is having the zymogen granules. So here we have completed the mota all about the salivary gland tumor from the basics. So ये पढ़ लिया मतलब Robbins से आपने salivary gland पढ़ ली. So बस ये सिर्फ only 13 slides. 13 slides में you have covered all about the salivary glands from the Robbins pathology, and you learn all the basics. So this is our salivary gland when it is seen, when it shows burger, pizza. So saliva secrete होए जा रहा है. So this is Dr. Siddhi Dave signing off. Follow my Instagram page, YouTube channel and Telegram channel. So this is Dr. Siddhi Dave signing off.